Good morning, Ngaramtse. Excellencies, dear partners, colleagues, media, friends. We're very happy to be here today. I've been waiting for this moment, and I'm not making a usual speech. I prefer to keep a few slides just to capture key moments, and I know that there is a video that will show it better. Allow me to just take you through these few slides. All right. So I think you all remember this communique, September 27, that was announcing the virus that never happened in this country. And this was a day no one wants to have or experience, but it had happened, and we had to assume it and decide what to do, either delay until we have more consequences, or act quickly until we contain. And the next day, I remember we all came together as partners. Most of you may remember this picture. And the Minister of Health, when we were sharing the initial information we had about the outbreak, the cases, the transmissions, and even trying to answer the difficult question, where infection came from. It was too early to respond to three important questions. Number one, how do we save the lives of people already infected as quick as possible? Number two, how do we cut these transmissions and stop this virus to spread? And number three, how do we know where it came from so that it doesn't happen again? So these were the three questions, the three missions we had to go through together. And the first weeks were probably the most difficult ones, because this is the time we recorded almost 50 of 66 cases we had throughout this outbreak. Just in 2 weeks, we had 50 of all the cases. And that's the time we had almost 80% of the deaths we recorded, which means the people were infected before we even know, and we're still struggling to even know who had it and who infected who. It was a very difficult time. And as you see on the right side of this slide, healthcare providers were the most infected, the top bar, meaning that this new cluster, this cluster of infection in the hospital, in the ICU, was actually still infecting healthcare providers who were exposed and the cases we were treating. Weeks later, we started to see a positive trend from the third week, fourth, until we started to see good news coming, one case or no case, even consecutive days, a week without a case, then restarting with a new case when we're hoping that things are getting over. But this type of virus always has a very long tail, like we say in epidemiology. So we continued to understand where infection came from. It was very difficult. First 10 days, we're trying to see if it may have a link with the recent outbreak in neighboring country, Tanzania, in the east. And most of our efforts were going to east, because we had some links to the east, especially with a case that had traveled from the east, from a refugee camp, and linked to the initial cases. So all our efforts were towards east, trying to link it with the cross-border transmission. That took us a week, 10 days. We found no link. Then we had to go back and retreat and restart from scratch from the files and see how can we trace the origin of infection from even backwards, not just September? What if the infection came in August? What if the infection came in July and we didn't know? So we went at that level from July 1st, reviewing every single patient file in the hospital that was most affected. And that helped us to find the starting point towards the index case that we updated you before, but I'm repeating it in case someone wasn't here at that time, previous briefing. So by reviewing 120 patient files that were admitted in the ICU at King Faisal Hospital, we found one case was clearly an MVD that was not detected by then. By doing a contact tracing for that case that unfortunately had passed, it took us to the cave where we found this 27-year-old male was working in the mining site, was still alive, but we didn't know he had contracted this virus and infected a spouse and ended up into ICU. And that took us to the cave, to the bats, to the lab diagnostics, from PCR, serology, antibody testing, to the sequencing, to connect all these points. That is how we managed to find the index case into the cave, not far, not the east actually, closer than we thought. And this for us was an answer to the third question, where infection came from. And that started another journey of trying to now build a stronger surveillance on the bats, not just in this cave, but across the country. So identified in all mining sites, in all caves in Rwanda, about 50 caves or mining sites where bats were closer to people and where, if we had delayed more, could have started another new infections. So now we have mapped all the sites. And this is it's not one-time activity. It will continue, and we're going to do this surveillance on a regular basis, especially that we know more about bats, their behaviors, and how the birthing twice a year in February and August, that's the time they shed more viruses, that's the time we have more risks to acquire infections. That's the time most outbreaks actually had happened in the past in the region. So these are new knowledge we have been pulling together by digging deep and understanding, trying to answer these three questions. And this also helped us to even trace contacts that we didn't know they were linked, particularly one case that developed symptoms while we were following these miners, more than 1,500. One of them developed symptoms during the follow-up, and he happened to be working in the same tunnel with our index case. And we were lucky to find it by the time he wasn't going to start an infection. So this really was an opportunity to understand and know more how we can build even more stronger surveillance systems in Rwanda and beyond. And we are sharing this because we believe is important for the scientific community for better preparedness and response. Let me talk about the case management. Again, here we've seen a change in the trend in the previous statistics that if someone is infected from Marburg virus, the survival rate would range between 24 to 88%, and on average 50% of people infected will die from the virus. So our healthcare workers worked hardly to make sure that we get to the lowest of this case fatality rate of 24%. They actually made it even better by going below that global standard. They challenged the standard that were there before for previous outbreaks. We have a case fatality rate of 22.7%. And it didn't happen by chance. It happened because of these people, because of the tools they received, medicine, They received vaccines, everything they tried to save every single life that was in their hand. I use these two pictures because this is a real case of a nurse, a chief nurse actually, at the treatment center. This picture on the right side of the slide that was shared by Dr. Menelas, I don't know if he's in the room, was taken live when this nurse was just after 4 hours spending in full PPE. And it was full of water everywhere, sweating. You can imagine how hot this environment can be and how this job can be tough. And this was just not one day. This was 3 months, 2 months, 3 months, and even now as we speak, they are still following up on survivors, they are on surveillance, in the ICU for other patients. So the work of healthcare workers is not easy, it's tough. And we're here also to recognize their work. They were brave, they were committed, even facing death with a case fatality rate that high. And we also recognize the lives of those we lost, particularly frontliners, those most experienced healthcare workers. We had a 2 days event to remember and even recognize their role to protect us, to protect our nation, and also to protect the world. And 15 lost their lives, majority are healthcare workers. Their lives will always be remembered because what they did was for us to all be safe and tell this story. As I said, a case fatality rate of 22.7%, never recorded before, was a fact that when you bring in all these efforts, you can even reach better results. And I believe the next outbreak, if as a global community, a global scientist, expert, stakeholders, we can even go to below this number. It's just showing that this is possible with the tools we have and commitment and speed of the response. We are also interested to continue share and work with partners across, and also everyone work to make sure the world is safer. Some of these information are being shared across the world. We have first publication on this genomic transmission dynamics, the sequence done by our teams here with our partners. We understand the importance of sharing this information for better preparedness for us, but also for others. And there are more stories that are going to be written to share in different formats. Now, Marburg is over. What's next? We believe that it's not completely over as still we have these risks, especially the bats that need to be surveilled. We continue to build these capacities. We build new teams. We build a new strategy moving forward. And even adding on technology to follow these bats, where they're moving, how they behave, who they're visiting, who is interacting with them, and make sure we stop these interactions in One Health context. This is very important. We believe also that survivors of this virus need to be supported, followed. We need to avoid stigma, but at the same time, making sure that those who are affected psychologically, mentally, they still need us, they still need scientific, clinical, to make sure also this virus is completely out of their body and their systems. There are many things we need to do moving forward in surveillance, building lab capacities. What we had was useful to know, but it's not enough to continue. Detect early, especially in ICU, in emergencies. There are new technologies we need to embrace, and as a country we want to continue to provide our support to ourselves, but also to the continent and beyond, to what we're learning from this viral hemorrhagic fever, as we are the most recently affected, and we don't want this to happen to anyone else if we can provide better tools. Tracking bats, this picture in the middle, actually, I was surprised to see how these fruit bats look like. They can bite. Some people call them, these are small flying dogs. They love to eat fruits. That's why they are called fruit bats. They can, but they live mostly in the cave, hiding in the dark areas. Normally, they shouldn't be interacting with people. But when human activity go towards them, it happens what happened. And we need to make sure that we create an environment where bats and humans are not interacting. And most of the cases are humans actually causing these disruptions. And we should be the one creating a safer environment, both animals, environment, and ourselves, to protect ourselves, but also protect these other species, because they are useful. They are useful to our lives. They participate in our agriculture. They participate in protecting us for other outbreaks. Actually, some of these bats eat a lot of insects that, if they are not there, will face other outbreaks like dengue, malaria, and others. So we shouldn't be seeing them as a threat. Actually, they are our protectors in a way, until we disconnect this environment, then it became our problem. So dealing with them, we need to understand all this ecosystem. It's not a health issue. It's not agriculture or animal resources issue. It's an issue for all of us to work together. So we're adding new technology, thanks to our partners, to track these bats with GPS. We're starting in a few weeks to make sure that we understand and we know these migrations and movements. And we'll keep you updated on these new developments of surveillance, but also knowing the next outbreak before it happens, before it lands into our hospitals. So I'd like to also mention these two periods, February and August. These are the most critical times, because that's the time these bats are shedding more viruses, at the time they're bursting. And that's the time we will be collecting more samples from these bats across these mines. So we already established this plan. We already have teams ready, equipment. They're calling them Batmen, that are going to help us track these species and to protect us, but also to contribute to the global scientific knowledge. So February is soon. There's just 1 month in between. So this work, again, will inform us on how we strongly build our capabilities in preparedness response. I'd like to conclude by saying thank you to all our partners. Thank you to frontliners, and thank you to everyone who made this journey possible, from the day of panic and fear to the day we are at the finish line, and the day we're seeing that Marburg can be handled quickly with the tools we have, and with partnership, everything is possible. Thank you very much. Murakoze cyane. Thank you.
Honorable Minister, Dr. Sabin Nsanzimana, Your Excellencies, members of the Diplomatic Corps, development partners, distinguished guests, representatives of the media, ladies and gentlemen. Good morning, Mwaramutse. First of all, I would like to extend my heartfelt congratulations to the government of Rwanda through the Ministry of Health, specifically you, Honorable Minister, for the exceptional leadership in effectively containing the very first Marburg virus disease outbreak in Rwanda. Your decisive actions, unwavering commitment, and rapid response was instrumental in preventing widespread negative and impact and safeguarding lives. This remarkable achievement underscores Rwanda's strong health system, its resilience, and steadfast dedication to protecting public health. Today, we gather to mark a monumental triumph, the official declaration of the end of the Marburg virus disease outbreak in Rwanda. This is not just a milestone. It is a testament to the indomitable spirit of the Rwandan people, to the strength of country leadership, the bravery of the healthcare workers, and the transformative power of collaboration and partnership. The rapid and coordinated response led by the Ministry of Health with the support of WHO and all of us as development partners was nothing short of extraordinary. Together, we moved with urgency to ensure the detection, isolation, and containment of this threat, while communities were rapidly mobilized to protect lives and restore hope. I am happy to report, Minister and colleagues, that WHO had about 20 of the best world experts on viral hemorrhagic fever and controlling outbreaks deployed to Rwanda and rotating at all times during the outbreak from the WHO regional office and WHO headquarters, together, of course, with my country team here in Rwanda, who were all purposed to support the outbreak response. WHO also deployed 39 AVOC SAGE experts from the governments of Uganda, Liberia, and Sierra Leone. And this was the largest deployment of first responders ever. And these were specifically requested by Minister for their expertise to help cover gaps in ICU and emergency care as a result of the outbreak that heavily impacted health workers, demonstrating remarkable solidarity among member states in the region. I would like to also add that we have been honored as WHO to have been able to work very closely with a wide range of partners to support the government in this response. We were able to coordinate ourselves as development partners under government leadership, and we effectively and efficiently responded to the national needs, ensuring that our collective efforts were indispensable to the response. Together, we elevated our partnership to unprecedented levels, strengthening our shared commitment to health security in supporting the government of Rwanda. I wish to express WHO's deep gratitude to fellow UN agencies, to Africa CDC, to the US government, to the European Union, to the British government, together with the governments of Liberia, the government of Uganda, and the government of Sierra Leone, the Global Outbreak Alert and Response Network collaborators, to all the bilateral partners, the multilateral partners, international NGOs, and all other partners and individuals who contributed to this effort. On behalf of WHO and on behalf of all development partners, we are proud to have worked hand in hand with the government of Rwanda and contributed to the achievement of this remarkable milestone in the Marburg outbreak response. Through decisive case management and a comprehensive strategy, loss of life was significantly reduced and community transmission was stopped. With the case fatality rates for Marburg outbreaks the world over known to range between 24% to 88%, Rwanda's case fatality rate of 22.7% is a stellar achievement. This unified effort, driven by rapid detection, contact tracing, isolation, intensive early treatment, and community engagement, has set a new regional benchmark for managing filovirus outbreaks. The outbreak underscored the need to strengthen international health regulation capacities, which are fundamental to building robust health systems capable of responding effectively to future public health threats. WHO remains committed to continue partnering with the government of Rwanda to enhance these capacities, ensuring that the country is well prepared for any emerging challenges. Furthermore, the outbreak highlighted the critical importance of the One Health approach, which recognizes the interconnectedness of human, animal, and environmental health. By integrating efforts across sectors, we can more efficiently prevent, detect, and respond to health threats. One Health is not just a strategic framework, it is an essential approach in a world where health threats know no boundaries. This victory, Honorable Minister, Your Excellencies, however, is not the end. We look forward to the after-action review that is being planned by Ministry of Health with WHO and other partner support that will document the response and the lessons learned, including the critical importance of preparedness and early detection. To our health workers, community leaders, and all those who contributed, we express our deepest gratitude. Your dedication, resilience, and courage were the backbone of this success. To our colleagues who made the ultimate sacrifice, your bravery and selflessness will never be forgotten. Your legacy lives on in the lives saved and in the stronger health system we are building together. You are the true heroes, and your spirit will continue to guide us forward. As we close this chapter and look ahead, may the holiday season bring us all joy, peace, and the rest needed to recharge for the challenges and triumphs to come. As we celebrate, let us enter the new year with renewed hope, strength, and a unified resolve to building a healthier, safer world for all. I thank you.
Thank you very much to the WHO country representative. It's now time for the main event. At this time, I'd like to call Dr. Sabin to give us the official declaration.
So it has been a long journey, But today here we come to the end of Marburg outbreak in Rwanda. So Marburg is over. According to WHO guidelines, it took us for 2 days since the last patient tested negative and discharged from treatment center. And we've been counting days. So last night, at midnight exactly, it was the end of the 42nd day. Therefore, we declare Marburg over in Rwanda. Thank you.
At this time, we'll be seeing some video remarks.
Honorable Dr. Sabine, Minister of Health, and dear brother, Excellencies, Honorables, dear friends, all protocol observed. I regret that I cannot be with you in person today, as I have just landed this morning in Addis Ababa from China, where I was seeking solutions to advance our local manufacturing agenda in Africa. On 26 of September 2024, I received a call from the minister informing me that Rwanda was experiencing Marburg outbreak. In less than 24 hours, a team of 11 colleagues from Africa CDC, representing diverse backgrounds, arrived in Rwanda to assist. From that moment, the country received substantial support from so many partners, and I thank all of them. For Africa CDC, this outbreak represented an additional challenge, while there were several other health crises on the continent, including mpox and others. Today, we stand together to celebrate the official end of the Marburg outbreak. We extend our heartfelt congratulations to President Kagame and the government of Rwanda for the exemplary leadership demonstrated throughout this crisis. This achievement is not merely a triumph of sense, coordination, and resilience. It is a testament that when Africa can accomplish unity under capable leadership, we can see things moving. Beyond technical interventions, this success underscores the power of community engagement. By involving local leaders, educating communities, and building trust under the leadership of my brother, Dr. Sabit, we effectively confronted fear and misinformation. This ensured that interventions were understood, embraced, and implemented at the grassroots level. I can recall the challenge we were facing when the outbreak was declared. No diagnostics, no vaccines, no medicines. Therefore, I urge all partners present today to commit clearly and strongly to the agenda of local manufacturing in Africa. Some messages from some partners have been discouraging, and this must change. Africa possesses the capability to manufacture and utilize its own vaccines, medicines, and diagnostics. We seek your support and your understanding for this agenda. The fight against emerging infectious diseases is far from over. However, with the commitment demonstrated by Rwanda and the support of partners across Africa and beyond, I'm confident that we can continue to respond effectively, build a resilience, and prevent future outbreaks from devastating our communities. I thank you.
Your Excellency, President Kagame, Honorable Minister Sanzimana, Excellencies, ambassadors, partners, members of the media, dear colleagues and friends, Muraho, I congratulate the people and government of Rwanda on the end of the outbreak of Marburg virus disease. In particular, I congratulate His Excellency the President for his leadership and personal engagement in the response. I salute especially the health workers who put themselves in harm's way to save their colleagues, and I honor the memory of those we have lost. When I visited Rwanda in October, I was very impressed with what I saw. In providing critical care, conducting trials of vaccines and therapeutics, and in using technology to provide real-time information for action. Patients were intubated first for a viral hemorrhage fever in Africa. Together with our partners, WHO was proud to support the government in the response with technical experts, personal protective equipment, test kits, and other supplies. And I thank Africa CDC and my brother John Kaseya for his partnership and collaboration. I thank the United States, the European Union, and the United Kingdom for the funding they have provided, and Liberia, Sierra Leone, and Uganda, who showed great solidarity in sending health workers to support critical health services. Congratulations once again. WHO remains committed to supporting Rwanda in its journey towards a healthier and safer future for all its people. Well done, murakoze cyane.